Hello everybody, this is Wanda Sakinen coming to you live from Youngstown, Ohio. And today we're going to do a product information session on HCG2, or maybe you'd like to refer to it as HCG squared from Total Life Changes. Again, my name is Wanda Sakinen. I just like to make a quick disclaimer. Total Life Changes does not offer any medical cures, though evidence of results are there. IBO earnings will vary. HCG. So what is it? Human chorionic gonadotropin, which is a pregnancy hormone. And so what does it do? It breaks down the stored abdominal fat and increases metabolism. In pregnancy, this is to prepare for the baby in the belly. Okay, what else do we have going on here? We have L-carnitine. And I listed all the different type of words that it can also be considered. I'm not going to go through all of them. I'm having a hard enough time as it is. Okay. So, what is this L-carnitine? It is an amino acid, a building block for proteins that is naturally produced in the body. How does it work? This helps the body turn fat into energy. It is important for heart and brain function, muscle movement, healing wounds, and removing waste from the body. And also the kidneys, but that kind of goes with that. Okay, a little fun note here is supplements are used for premature babies, genetic disorders, seizures, chest pain, congestive heart failure, and for vegan dietary sources. Okay, so you're probably saying, well, what do the experts have to say? You've heard enough from me already. What about the experts? Well, according to WebMD, this diet is commonly used with a very low-calorie diet, usually no more than 500 to 800 daily calories. This was very popular back in the 50s, and I believe it's making a pretty big comeback. What about the side effects? Gallstones are always a chance with any low-calorie diet, but not necessarily from the drops themselves. You would want to discontinue taking this if you have headaches, fatigue, restlessness, depression, or retained fluid. Do not take if you're pregnant. You'll want to check with your doctor, and I think anybody on this low of a calorie diet, if you're going to do that with the drops, you really should seek medical advice just in case, especially if you're on a lot of medications, or you have chronic diseases, or you're elderly, or even a child. So okay, and also you do not want to use it if you have prostate cancer, because it has been known to exacerbate or worsen the symptoms. Alrighty then. What are the drug interactions? Here's the big one. According to the experts, there are none to date. Nothing, no drug interactions. We'll try to find that with your pharmaceuticals, okay? And how do I take this? You take it orally by mouth, as a liquid, drops, or also as an injection. Total Life Changes only has the drops. How much do I take of this? HCG is usually given in doses of 125 to 200 international units a day. Okay, does this really work? Is this just a bunch of hype? Well, here we have a couple pictures here showing you how these ladies They look a whole lot better now. Does it work? You gotta be the judge. Looks pretty convincing though. Oh, okay. I'm sorry, I kind of lost my train of thought there for a second. Anyway, now we're going to look at the reviews that I took straight up from WebMD, okay? These are 3 different patients. The first one's a male, 45 years old. He says, I have dilated cardiomyopathy and take these to help with fatigue issues. The proof that these work was when I stopped taking them for a few days because I'd ran out and my fatigue returned. Okay. And I know cardiomyopathy isn't spelled right, but I copied and pasted this straight from WebMD. The second patient says they took 1,000 milligrams twice a day, worked weight machines 3 days a week, lost weight but mostly inches, went from a 44 waist to 34, lost 8 inches, ate a balanced diet, no processed food, in 2 months had energy like crazy. The guy even puts his name. He's 45, in the range of 45 and 55 years old. The final review, and there were plenty on there, and I'm sure if you scour the internet, they're all over the place. This is a miracle for me. I'm always so tired. At 43 years old, my body is always low on energy. Energy drinks and pills make me too jittery. L-carnitine gives me that non-jittery, steady energy all day. I seem to feel better through the day. I take 1 tablespoon every morning on an empty stomach. It is the best thing I have tried. This is from a female, 43 years old. Okay, so we're finally at the end here. Where do you get some? There you are, all the information you'll ever need, right? Okay, well, I'd like to thank you all for watching this presentation. Please feel free to subscribe to my channel, like, share, comment, ask questions, whatever you must. Tomorrow is going to be the 10th video, and maybe it's time that I just introduce myself to the audience, and that'll take place probably tomorrow. Okay, have a great evening.